What if picking a Medicare plan could feel calm and clear instead of confusing and rushed? Today, I will guide you through a simple, step-by-step process to compare plans, avoid common money mistakes, and choose with confidence. Hello and welcome to Senior Smart Money. I am glad you are here. This channel is a gentle place for people in their 60s, 70s, and beyond. My goal is to explain important topics in a friendly way so you can protect your health and your wallet without the stress. Before we begin, one promise. You do not need to know every Medicare rule to make a good choice. You only need a short checklist, a few key questions, and a little time to compare. Section 1, the simple map of Medicare. Think of Medicare as a map with two main paths. Path 1 is original Medicare. That is Part A for hospital care and Part B for doctor and outpatient care. Most people on this path add a Part D plan for prescriptions and may add a Medigap supplement to help pay deductibles and coinsurance. Path 2 is Medicare Advantage. This is called Part C, and it bundles Part A and Part B into one plan, usually with drug coverage included. Advantage plans often add extra benefits like dental or vision, and they use networks of doctors and hospitals. There is no one right answer for everyone. Original Medicare with a Medigap plan offers wider access to doctors nationwide. Advantage plans can offer lower premiums and extras, but they use networks and rules. The best path is the one that fits your health needs, your doctors, your medications, and your budget. Section 2, the timeline at a glance. There are a few key windows that matter. Initial enrollment happens when you first qualify, usually around your 65th birthday. The annual enrollment period happens once a year in the fall. This is the time most people can review and change plans for the next year. There are also special periods if certain life events happen. The important idea is this: you do not need to get everything perfect the first time. You will have chances to review and adjust. Section 3, the cost you actually feel, not just the premium. Many people focus on the monthly premium, but the real cost includes more. Use this simple checklist. Monthly premium. Annual deductible. Copays or coinsurance for doctor visits, tests, and hospital stays. Drug costs for the medicines you take. Out-of-pocket maximum for the year if you are in an Advantage plan. Write these on a single page for each plan and add them up for your typical year. A plan with a low premium can be more expensive if your copays and drug costs are high. A plan with a slightly higher premium can be cheaper overall if it covers your regular care and medicines better. Section 4, your doctors and hospitals. If you have doctors you trust, check whether they accept the plan you are considering. For original Medicare, most doctors nationwide accept it. If you add a Medigap plan, you usually keep that broad access. For Advantage plans, care often happens inside a network. Ask directly, do my primary doctor and my specialist take this exact plan? What about my local hospital? If a plan looks good, but your main doctor is not in network, you may prefer a different plan. Section 5, your medications and the drug list. Every plan has a formulary, which is a list of medicines it covers and the tier that each medicine is in. Tiers affect your cost. Make a short medication list. Write the name, dose, and how often you take it. Check each plan to see if your drugs are covered, which tier they are in, and whether the plan has preferred pharmacies that charge less. If a plan requires a prior authorization or step therapy for one of your medicines, ask how that works. You want fewer surprises at the pharmacy. Section 6, extra benefits and how to value them. Some Advantage plans include extras like dental cleanings, basic vision exams, hearing aid help, gym programs, or allowances for over-the-counter items. Extras can be helpful, but only if you will use them. Ask yourself, will I schedule these services and use them this year? If yes, include a reasonable value in your comparison. If not, do not let a long list of extras distract you from the basics of doctors, hospitals, and medicines. Section 7. How to compare plans in one calm sitting. Set aside a quiet hour, make tea, breathe, and follow these steps. Step 1. Gather your list, your doctors, your hospital, your medications, and your preferred pharmacies. Step 2, pick 3 plans to compare. 1 original Medicare path with a Medigap and a Part D plan, and 2 Medicare Advantage plans from different companies. Step 3, for each plan, write down premium, deductible, typical copays, out-of-pocket maximum, and drug costs for your specific medicines. Add a small note about your doctors and hospital access. Step 4. Circle any unknowns. If the drug list is unclear or a copay is missing, call the plan and ask for the answer in writing or by email. Step 5. Sleep on it. A good decision today will still be a good decision tomorrow. Give yourself a night to think before you enroll. Section 8. A gentle conversation script you can use. When you call a plan or an advisor, speak slowly and simply. It is perfectly fine to read from a paper. Try this. Hello, I am comparing Medicare options. I would like answers in clear dollars, and I will take notes. First, do my main doctors and my local hospital take this exact plan name? Second, are these medicines covered? And what are my copays at a preferred pharmacy? Third, what is my annual out-of-pocket maximum for medical care? Fourth, are there any approvals I need before seeing a specialist or getting a test? Thank you for speaking slowly so I can write this down. If someone rushes you or avoids clear answers, that is a sign to call someone else. Section 9. Common money mistakes and how to avoid them. Mistake 1. Choosing based only on the monthly premium. Fix. Add up your total expected cost for the year, including drugs and copays. Mistake 2. Assuming your doctors are covered. Fix. Confirm doctor and hospital acceptance for the exact plan. Names can be similar. Mistake 3. Forgetting to check the drug list. Fix. Match your current medicines to the plan formulary and look at the tiers. Mistake 4. Ignoring the out-of-pocket maximum and Advantage plans. Fix. Know that number. It protects you in a year with many appointments. Mistake 5. Waiting until the last day of enrollment. Fix. Start early, make one comparison per day, and ask for written answers. Section 10. Examples that make the math real. Mary takes 2 brand name medications and sees a specialist 4 times a year. A low premium plan looked attractive, but her copays for the specialist and her medicines made the total cost higher than a slightly more expensive plan that covered her drugs better. She chose the plan with the better drug coverage and saved money across the year. Robert has a favorite doctor and a seasonal home in another state. He chose original Medicare with a Medigap policy so he can see doctors in different places without worrying about networks. Angela is comfortable with a local network and wanted dental cleanings and a gym program. She chose a Medicare Advantage plan that includes those extras and confirmed that her clinic is in network. Different needs, different answers, all thoughtful. Section 11. Travel, second homes, and seasonal care. If you travel often or spend part of the year in another state, ask how the plan handles care away from home. Original Medicare with Medigap usually offers broad access. Advantage plans vary. Some cover urgent and emergency care out of area, but regular care often needs to happen in network. Knowing this in advance prevents frustration later. Section 12. Working with a trusted helper. If you feel more comfortable with a second set of eyes, invite a trusted family member or friend to sit with you. Put your notes on the table and review together. You can also speak with a licensed agent who represents multiple companies. Ask them to show their comparisons on paper and to explain anything that feels unclear. You are in charge. Take your time. Section 13. A calm checklist you can do this week. Print your doctor's and hospital list. Print your medication list with dose and how often. Pick 3 plans to compare. Write down premium, deductible, copays, drug costs, and out-of-pocket maximum. Confirm your doctors and hospital for each plan. Confirm your medicines and pharmacy costs. Sleep on it and choose calmly. Section 14. Mid-video reminder. If this guide is helpful, please tap like so more seniors can find it, and subscribe to Seniors Smart Money for gentle, practical videos each week. Your support helps this community grow. Section 15. Quick recap. 2 main paths: original Medicare with optional Medigap and Part D, or Medicare Advantage that bundles care and usually includes drugs. Look beyond the premium to the full year cost. Check your doctors, hospital, and medications. Be careful with networks and drug tiers. Extras are nice if you will use them. Ask for clear answers in writing. Sleep on your choice, then enroll with confidence. You deserve health coverage that respects your time and your budget. You do not need to learn every detail today. Just take one small step. Make your lists, compare 3 plans, ask one clear question. Each small action brings more peace of mind. Thank you for spending your time with me today. I appreciate you. Wishing you good health, calm decisions, and a plan that fits your life. Important note before we close. This video is educational and not personal medical or insurance advice. Medicare rules and plan details can change. Always review the official information and speak with a qualified professional who understands your situation before making decisions. Take good care, and I will see you in the next video.